Hello, my name is Tatiana Echeverry, and I'm currently a primary care physician at the medical offices of Manhattan. I went to medical school in St. George's University in Grenada, and you just can imagine how hard it was to study in the beautiful Caribbean. Then later on, I went to the tri-state area and started at Overlook Medical Center and trained in internal medicine. I'm very passionate about this field because I was able to see firsthand the experiences that my parents had when going to the doctor. I'm a native speaker in Spanish and Portuguese. Just the language barrier that my parents had and the struggle they had answering questions or asking questions about their medications. So I'm just very passionate about educating my patients to ask questions about their medications. So currently I'm active in the American College of Physicians as well as the American College in Cardiology. So I enjoy cooking, but also I like mentoring young professionals. And during residency, I started a Big Brother, Big Sister program to kind of support the incoming interns, which is something that I'm very proud of. Prediabetes is a condition where you have high sugar in the body, which is not normal. However, it's not very high where it's considered diabetes, and that means that lifestyle changes are needed. So prediabetes is diagnosed with a blood test called A1C that measures how much sugar you have in your blood. So the ranges for prediabetes look something above 5.7 to 6.4. And if it's above 6.4, it would be the range of diabetes. And it actually looks 3 months back and to see how much sugar you actually have in your body, and you don't need to fast. So the risk factors to developing prediabetes are hypertension, obesity, sedentary life, and this is why we recommend lifestyle changes if you are firstly diagnosed with prediabetes. The other risk factors for prediabetes is high cholesterol and also sleep disorders like sleep apnea. So the symptoms for prediabetes and diabetes are actually very similar. Sometimes you can have increased urination, increased hunger, and those symptoms are not normal. And also you can have actually something called peripheral neuropathy, where you start feeling burning sensation in your feet or hands, and that will trigger us to do the test for prediabetes. Yes, this is actually a great question. I have a lot of patients that come in our practice and just think that prediabetes means eventually having diabetes, but lifestyle changes can help as well as aerobic exercises. So we'd recommend for patients with prediabetes to reduce their carbohydrate intake, since carbohydrates actually convert into sugar in the body. We also recommend a decrease your fat intake as well as increase exercise. So you would need to exercise about 5 times a day for at least 30 minutes of intense exercise. Yes, so normally we begin medication if at the 3 to 6 month mark with lifestyle changes, the A1C doesn't change, we start something called metformin, which helps to reduce the sugar in the blood. So we recommend checking the A1C for prediabetes every year. However, if your A1C is already elevated, we recommend checking every 3 months to prevent diabetes. So there's a lot of complications, unfortunately. So one of them would be blurry vision, because the sugar actually goes into the eye, and then you can have something called glaucoma, which is high pressure in the eye. Also, you can have complications in the legs, which is the sugar damages a lot of the nerves, and you have something called peripheral neuropathy, where you have a lot of burning sensation in your legs and arms. You can also have issues with your kidney function. So the kidney is able to regulate your urine and also toxins, so diabetes can actually damage that barrier. I mean, what is there not to like? I really love food, the culture, and just the fact that you're able to share each other's culture. It's something that I really love. When I first joined, which it's quite recent, everyone was very polite and everyone was very helpful, and they were able to get me up to speed very quickly.